All right, we have a 60-year-old female today presenting with greater trochanteric bursitis and IT band syndrome. She has a positive Ober's test, positive Faber, and she is tender to palpate here at the greater trochanteric bursa along the IT band. Here in the muscle of the IT band, she has excessive tenderness all the way down into the distal IT band insertion. So we're going to begin a FRAMS tour today. This is her first time ever having FRAMS. And we're going to take some of the cocoa butter here and apply a moderate amount along the lateral thigh. We will begin today's treatment with F1, the F1 tool, and we will first of all spread out the cocoa butter evenly over the lateral IT band in greater trochanter region. Then we will begin the process by holding the F1 tool at a perpendicular to her skin, applying approximately 3 pounds of pressure down and making long longitudinal strokes from distal to proximal. Now, we've made a few strokes here. What level of pain are you feeling, 0 to 10? With
Depends
that?
what spot you're in.
Right, the worst spot.
Probably about a 4.
Okay, so she's feeling a 4/10 on the numeric pain rating scale. Right here in this area, the middle of the IT band, we're feeling a lot of fibrosis there. The tool is shuddering as I go over that area. And then here, just posterior of the trochanter bursa, we feel a little bit here at the distal IT band also. Now that we've done 3 or 4 longitudinal strokes going from distal to proximal, we'll turn now and go from proximal to distal. So what's the level of pain now in this area? 0 to 10 in this area as it goes over it.
Probably about a 7.
So the pain is increased to a 7 going from proximal to distal, especially in the middle of the IT band. And you can see her foot, how it turns up because of the discomfort. And again, I'm putting the same amount of pressure, 3 to 5 pounds of pressure down as I'm going, keeping the F1 tool perpendicular to the skin.
Ow, ow, ow.
She's going to wonder why she agreed to do this.
I know. I'm thinking, what in the world?
Okay. So that completes the F1 tool. Now we're going to progress to using F2. And with this one, we'll make medium long strokes. Again, starting at the distal IT band and working up.
Ow.
Okay, you okay?
Mm-hmm.
All right. So sometimes, depending on, again, this is her first time ever receiving FRAMS, you will have to back off and give them a little time to recover. But most patients will hang in there with you because they understand the benefits. Once they are able to identify the fibrosis, they will hang in there with you so that you can complete the treatment, because they can actually feel the fibrosis as well as you. Now with the F1 and the F2 tool, we were able to identify most of the fibrosis in this region here, distal and proximal. And I haven't found any new areas of fibrosis with the F2 tool. So now let's go from the hip back down to the knee. What is that right there? What pain is that right there? 0 to 10.
depends where you're at, but right there in the
Right
middle.
What was that?
It's probably about an 8.
So she's up to an 8 out of 10. And that's generally what we're seeing when doing FRAMS on the IT band. See if you can get a little close-up here to see some of the erythema that is developing here and in this area here. Can you see that? This area here. Okay.
Yeah.
Okay. Now we will go to the F3 tool, and we will now do medium short strokes, and we will concentrate on the 3 areas that we have identified with F1 and F2. And the stroke is going from distal to proximal, directly over the greater trochanteric bursa. Now get the area close up here. This area here. The erythema. Again, we're holding the tool at a 90-degree angle. We have it got it down at a 45, but at a straight 90-degree angle. And we're putting approximately 3 pounds of pressure. Now we're going to progress to the midsection of the IT band muscle belly. And you work 3 to 4 strips, distal to proximal, then proximal to distal. Now let's progress on. Let's clear this up a little bit and come directly to the distal IT band. This is a great case to show you because she has several areas of fibrosis, and it is significant fibrosis. In general, the first treatment will be the worst because you will remove much of the fibrosis during that first treatment. But you will do layer by layer over the next. She will probably take 8 to 9 treatments to get her back completely well. And each treatment will get better. She will gain some benefits from today's session, but where she will experience most of the benefits is after about the 4th to 5th session will she be able to really tell during her activities of daily living. Now we're going to F4, and we're going to do very short strokes here, concentrated again over the areas of fibrosis. And I'm using the convex side of the tool of F1. You could use the concave side, but I'm going to use the convex side here. I can tend to feel the fibrosis a little better on the contour of her body with the convex side. Now I'm going to go from proximal to distal. Can you feel a difference in the different tools that I use?
Mm-hmm.
Okay, so she can feel the difference between F1, 2, 3, and now 4. And as you have to, you can just move the cocoa butter out of your way. Now we'll finish up. Again, I'm using the convex side for the distal IT band. And go both ways. It doesn't matter if you go distal to proximal first or proximal to distal first. Either one, just as long as you go both ways. Alright, and then we'll clean up. Now that we have completed the fibrosis release, now we're going to do the myofascial stretching portion of FRAMS. If you would, scoot back to me. To your backside touches my hip. Come on back. Right there, that's good. Now we're going to take with the knee extended and the hip extended, lying directly on the right side, we're going to give an over stretch here to stretch the to stretch the IT band as the IT band goes over the greater trochanteric bursa. Now we want to make sure, let's have you turn forward just a little bit. There you go. You want them to turn a little bit forward here as you stretch down. You feel that stretch there, Miss C?
Yes, I do.
Okay, is that tender or painful?
Not really. Feels good.
Okay, so that's somewhat of a good kind of hurt, a good stretch. You want to do a medium stretch here, and you want to hold it for 1 minute. Afterward, as we've done with previous patients, their exercise program would include knee to chest for 1 minute, a supine hamstring stretch with a strap for 1 minute, side-lying abduction strengthening exercises, and then we would instruct them to do the overstretch either in standing or if they have assistance from a family member to do it in side-lying for 30 seconds to 1 minute, 4 times a day, and then have them to do it every time they feel tenderness. So if she's going through her day and she feels some tenderness in the IT band or in the hip, we would encourage her to take just a moment to do the stretch of the IT band for 30 seconds. In this way it keeps the fibrosis from continually building, but we're continually tearing down the fibrosis, helping normal tissue and collagen alignment. And that completes today's treatment for greater trochanteric bursitis with IT band syndrome.